morning, my name's Allison.
And my name's Nina, and this is an important broadcast coming to you live on October 15th, 1951 from Chemistry News.
Here we see that the director at the Margaret Sanger Research Bureau and medical director and vice president of Planned Parenthood Federation of America gave a small grant to Pincus to begin contraceptive research.
The pills were first tested in Puerto Rico and found to cause too many side effects.
Pincus then tested norethindrone in Mexico and Haiti. This time, the pills were a success. Norethindrone will be the first birth control pill to be approved for sale in May 1960 in the USA. American biologist Dr. Gregory Pincus had worked with Luis Miramontes, who was working under the direction of the Austrian-American chemist Carl Djerassi and the Mexican scientist George Rosenkrantz.
This is the first major scientific discovery this year since these three major past events.
Al, don't you remember on January 27th when the United States began testing 126 nuclear tests in Nevada?
Of course, how about on May 29th when Charles Blair Jr. made the first solo flight across the North Pole?
How could I forget? But it couldn't be as exciting as when Dr. William Shockley invented the junction transmitter on July 5th.
Go.
So Al, what is norethindrone actually used for in everyday lives?
Its main purpose is to be used as a contraceptive for women, but it can also be prescribed to treat menstrual disorders.
So like endometriosis and heavy irregular periods?
Yes, and for those of you who don't know, endometriosis is a condition in which the type of tissue that lines the uterus grows in other areas of the body and causes pain.
As a form of birth control, it is sold under many different brand names, taken as a tablet, and should be taken at a set time every day.
Norethindrone is a form of progesterone or female hormone. It prevents ovulation, which is the release of an egg from an ovary. It causes changes in the cervical mucus and uterine lining, making it harder for the sperm to reach the uterus and harder for a fertilized egg to attach to the uterus. However, it does not protect against sexually transmitted diseases. Norethindrone is known to commonly react with acetate.
Norethindrone is recognized as C20H26O2. Its molecular weight is 298.42 grams per mole. It is a solid at standard temperature and its melting point is 207.8 degrees Celsius. Its density is 1.2 grams per centimeter cubed. It is a smaller molecule used as a synthetic oral contraceptive. It is taken as a tablet with white to off-white color. Here we see a young 12-year-old girl playing outside. She likes to ride scooters, practice pogo stick, and attempt to play her favorite sport of basketball. However, she stopped doing these activities of a typical child. She got involved with the wrong crowd and started doing things a 12-year-old girl does not typically do. When doing these things, she was not aware of norethindrone. This 12-year-old girl is now pregnant.
It's kicking. Oh no. Oh wee, my baby. Forest. Woo-hoo. Walking in the forest. Afternoon day we walk.
Before using norethindrone, you should be fully aware of the precautions of this drug. You should not use norethindrone if you are currently pregnant because it is used to prevent pregnancy and can cause birth defects in an unborn baby. You should not use norethindrone if any of the following conditions apply to you. If you have had a history of a stroke or blood clots, if you have blood circulation problems, if you have had or have breast cancer, if abnormal vaginal bleeding occurs with you, if you have had liver disease, or if you have recently had an incomplete miscarriage or abortion. Norethindrone can increase your risk of blood clots, a stroke, or a heart attack, especially if you smoke and are older than 35.